Hi everyone, we're Group 10. My name is Lily. We have 4 as team. The other teammates are Asish, Dinesh, and Songyue. Our project is Analysis of Inpatient Medicare Coverage for Top 100 DRG. So when you read this title, you may ask what is DRG and what is Medicare? So DRG is Diagnosis Related Group. And it is a classification system divides possible diagnosis into more than 20 major body systems. And also it can subdivide them into almost 500 groups for the purpose of the Medicare reimbursement. And how about the Medicare? What is Medicare? It is the federal health insurance program for the people who is 65 years of old or even older, and it also covers the people with certain disabilities as well as some end of stage disease like the renal disease. Okay, so the next is the goal and the objective. Our goal is to analyze and we predict the Medicare coverage for the top 100 DRG. For the objectives, we want to use our project to help the federal government predict the average covered charges, which is the Medicare coverage, based on the variables like the total payment, the total discharges, and the provider states, etc. And also we want to identify the certain states that have the higher average covered charges, more than the other states. And also, we want to identify the top 5 DRG which has the highest incidence rate. The last objective is to help the Medicare save money. We want to reduce the cost for certain DRG. Okay, the next slide is the schedule. We started our project on January 15th and want to finish before the May 2nd, which is the 4 month. So during the 4 month, we make some changes for our schedule because of the unexpected reason. In the first deliverable, we talked about the insurance payment towards the disease. However, we can't get this part of data. So in the second deliverable, our objective will focus more on the Medicare coverage instead of that. Okay, for the benefits, there are certain populations that can get the benefits, like the U.S. Department of Health and Human Services. We hope we can help the U.S. federal government predicting the Medicare cost for the top 100 DRG. Also, it can benefit the U.S. citizens. So when people in need of the certain treatment for the DRG, they can find the nearby hospitals which can provide better treatment and the higher coverage than the other hospitals. The last one is the hospital. We hope our project can encourage the hospital to be more transparent on the prices of the treatment through the legislation. Okay. The next is the limitation. We have several limitations. First, we missed on some values of population and per capita income. And also, we only use the 2 resources of the data, which can limit our findings. And next is our analysis can only be used within the United States because the data collected in the United States, we can't apply our findings into the worldwide. So for the cost, we keep our cost into the minimum level by using the secondary database that can be downloaded through the internet, and also we use the software that provides by the universities. Okay, the last part is the feasibility, risk, and implementation. We can easily get access to the software as well as the database from the internet. And the only risk that I want to mention is that the Medicare coverage for the top 100 DRG can be changed year by year, so our estimation may not be very accurate. The last part is implementation, and we follow the rules of the CRISP DM, which is the cross-industry standard process for the data mining. Okay, so next Asish is going to talk about the data preparation.
Hi, thanks Lily. I am coming for the data preparation. For the first part of the data preparation, that is data access. For data, we were searching for unbiased and accurate data. For that, we don't need any hospital related or insurance related data, and we directly got the data from data.cms.gov and factfinder.census.gov, where the data is authentic and by government. The next part is data consolidation. For the our data set, we need patient's location. That's a very integral data of our data set. For that, we merge from the main data using the zip code, and the data, complete data is now present with us. After that, we clean the data. For cleaning the data, after merging, we got that there are very few null values. Those null values were not required that much and insignificant. So we left it like that only. And there were excess columns after merging. Those columns were also removed because they can put some holes during model analysis and accuracy of the model. After that, we got data transformation. For data transformation, the columns had some different values which are not needed for analysis, like symbols, dollars, hyphen. We have removed those symbols first. After that, some columns have mixed data, the variables and integers together. We also separated them so that we can make different columns that can be used for analysis of models. We can see here the data dictionary we used. These are all the variables we have used. This is the data dictionary we have used. We can see all the variables that are used. The description and the data types, we can see that integer, varchar data are present, and the source of data, which is only government websites. After that, we quickly switched to model building. In model building, first we did descriptive analysis using Tableau. We didn't use any other software, and also we didn't think of any other softwares because we knew that Tableau is the king in this field. So, and we did the plots, simple plots using bar chart, pie chart, bubble chart, and map based chart. These charts are easy to learn and simple to understand. After that, we did predictive modeling, which is required for the primary objective. We have done various modeling techniques. First, we did decision trees using CHAT C5.0, then linear regression, logistic regression, neural networks, k-means clustering, and Bayesian network. From decision tree like CHAT and C5.0, we didn't get any result which is worthwhile. Also from neural networks, the accuracy is very low, which would make the model unfit to use. After that, we use linear regression model. From linear regression, we saw the strength of different criteria which are used for analyzing the average coverage cost. Using logistic reasoning, we saw the value of states towards the average coverage cost. The k-means also gave the result which is closely related to the objective of our project. Through Bayesian network, we got the relation of various DRGs and state values. With all these models, we have to choose. For choosing, we got the criteria that the result which is matched closely with the objective is chosen first. After that, the secondary level is the accuracy. We give second priority to accuracy because if accuracy is not good, the model cannot be justified. So from these all, we chosen linear regression, logistic regression, k-means clustering, and Bayesian network. Now I would like Songyue to tell you more about the next part.
Thanks, Ashish. Now I'm going to talk about our model assessment and result analysis. In our assessment, we divided into two parts. One is the model accuracy, one is the predictive importance. Now I'm going to talk about our first model's accuracy, the linear regression model. We got a square of 0.388, which means 38.8% of the response variation has been explained by our linear regression model. And the next model is the logistic regression model. It gives us a very excellent accuracy. It has overall accuracy of over 98%. Then the third model is k-means clustering, and we have 7 inputs. In this model, we also set the k equals to 3. Then the overall cluster quality is fair. And the last model is Bayesian network. The overall accuracy is about 72%. Then the next part of our model assessment is predictor importance. For the first model, which is the linear regression model, we can see the average total payment divided by per capita income is the most important predictor in this model. It's much more important than the other 3 predictors. Then the second model is the logistic regression model, and the provider state is more important than the other variables in this model. For our first model, the k-means clustering model, all of these 7 inputs are very important. Even the least important one, the average total payment, has over 0.6 importance. The last model is the Bayesian network. In this model, we know that the DRG definition has given more predictor importance in this one. Then now I'm going to talk about the result analysis in our project. We have 100 of DRGs in our dataset, but we are not able to analyze all of the DRGs at this time. So we only chose top 5 DRGs. So you can see in this graph, the 470 has the largest total discharge numbers. Then with all the data we have, we can do all kinds of analysis, like we can know the instance difference among different states, and we also can know the average total payment versus average cover charges for a certain DRG in different states. Then for the linear regression model, we have this equation, and we can see that only the total discharges has a negative relationship to the objective.
Start from the first.
Okay. Next, I'm going to talk about the linear regression model. We have this equation from this model, and we can see only the total discharges has a negative relationship to our objective, which is the average cover charges. All the other variables like population, per capita income, and average total payment divided by per capita income have positive relationship to average cover charges. For the logistic regression, it's a good model for us to know which variable is close to our objective, and we can see that the locations, the different cities, some different cities is more important than the others, so we can know that the location is much closer to the objective than the other variables. For the third model, the k-means clustering, we have 3 different clusters. All of these 3 clusters has their own characteristics. So now I'm going to talk about our last model, which is the Bayesian network. I'm going to take one example for this one, and from this graph we can know that the respiratory system diagnosis has about 0.24 probability of occurring in the cost range of more than $800,000. And next, I would like my friend Dinesh to talk about our conclusion and recommendations.
thanks Songyue, we have reached the conclusion part of our project. From our modeling techniques and the analysis, we found out that the Medicare charge directly depends upon the DRG group and the provider state. And these are the list of top 5 DRG incidences which incurs high average coverage cost. And also we found out from the analysis that per capita income of the state has direct relationship with the average coverage cost. So wherever the per capita income in the state is high, it had high average coverage cost. So that's why states like California, Florida, and Texas, which had high per capita income, had relatively high average coverage cost. Whereas states like Arkansas, Vermont, and Rhode Island, which had low per capita income, had relatively low average coverage cost. And some of the recommendations we put forth from the project is by providing free transportation for the inpatient to this neighboring less expensive state, Medicare can save thousands of dollars just by providing the free transportation to the inpatients. In this way, the neighboring less expensive state hospitals can benefit from the incentives that they get from the Medicare, and it will help them to equip with the better facilities. And the second thing is Medicare can invest a lot of money in the clinical medical research. In this way, the DRG group, which incurs high average coverage cost, can be significantly reduced. And the last recommendation is by increasing the portion of the coverage cost of the DRG group which incurs high average coverage cost. This will encourage the patients to undergo early medical checkup. So in this way, they can prevent the DRG group from occurring. And our original vision was the project is to analyze the cost patterns of the DRG in different hospitals, but by keeping stakeholders as the US citizen. Our project, our initial objective was to benefit the people by finding the cheapest hospital for the treatment of the particular DRG. But on halfway of the project, we realized that there is no significant data to support our objective. And also from the modeling, when we started developing the modeling techniques, we found out there is the modeling accuracy was not conceivable. So we had to change to some realistic objective. So in this, we have put forth to analyze and predict the average coverage cost for the Medicare based on the factors of DRG group, total payment, total discharge, provider name, and the city. In this way, the Medicare was this main stakeholder. This will help. This modeling will help the Medicare to predictive modeling will help the Medicare to frame their budget, and which will help the Medicare to gain more profitability and efficiency. Some of the lessons learned from our project is to set objectives that can be realized within a given data set. Initially, we set a different objective that cannot be realized with a given data set. So we had to change to a realistic objective. And the second most important lesson we learned is spend more time on the feasibility and risk assessment. If we had done more, given more time on the feasibility and risk assessment, we wouldn't have lost much time in the previous objective. So time management was a very key part in every project. So even though we lost some significant amount of time in the first part, we cruised in the later part. So, and for every project, identifying the target variable is the most important step. In this, we identify the target variable as the average coverage cost, so which directly supports the objective, and also set expectations and choose appropriate model. For example, in this project, we had some expectations. For example, while choosing logistic regression, we expected there is some significant relationship between the coverage cost and the input variables. So it is very important to have some expectations and then choose the modeling technique. And don't just select the modeling technique based on the accuracy. So for example, we developed a model Bayesian network which had a significant accuracy of 72%. Although we had only one dependent variable one dependent variable, so the reliability of the model was unknown. So don't select a model based on the accuracy.
Thank you.
Thank you.